In tonight's Economy Watch 10, the sequester drama in Washington, D.C. playing out in Indiana. Medicare cuts were just part of the nearly $88 billion in cuts that go into effect this year. News 10's Matt Gregory has the latest on what this means for health care right here in the Wabash Valley.
By now you've heard the word sequester more in 2 weeks than most of your life. But in order to see the effects of it for us, we can look locally right at the healthcare industry.
Now, if you focus on Indiana, Medicare spending amounts to about $10 billion a year for the state of Indiana.
According to Dr. Nathan Myers of Indiana State, the 2% Medicare cuts mean that nearly $200 million will be taken out of the state from the healthcare field. Across town at the Westminster Village retirement community, they say it could affect how some of their residents pay.
90% of our residents pay private pay, and so there's that 10% that it will affect payment for. So the 2% would be a direct hit on our revenue, so we would have a 2% less revenue in our Medicare revenue moving in 2013.
That's still going to have some negative implications, especially in a community like Terre Haute, where the medical community accounts for such an important part of the economy.
Now, back at Westminster Village, while they admit it's not ideal, the loss of revenue was something they can account for without making cuts to jobs or to services for their residents.
And we look at it every year, and we actually budgeted for a cut this year. So it's something that we plan for. You hardly ever expect Medicare to say, hey, we're going to pay you more money than we did last year. So usually we budget for a decrease.
Dr. Myers said that while the cuts are now going through, he doesn't expect the sequester to last past March. At that point, if it does continue, the government could have a shutdown, something Washington, D.C. hasn't seen since 1995. Back to you.
News 10 will continue to follow the sequester as it affects more people right here in our backyard.